Since 2011, Zambia has continued to join the rest of the world in commemorating International Day of the Midwife. The theme for this year is Women and Newborns at the Heart of Midwifery. This is why we have decided today to discuss the importance of a midwife in society. And it's a very catchy theme, I must say, very sentimental theme, because I mean, the newborn, the expectant mother and the midwife all are special in their own way. Okay, so we want to look at the importance actually of the midwife, much as we commemorate the day of the midwife. And so allow me to introduce my guests at this point. I have seated on my immediate left Mr. David Wyking, who is the Deputy Head of Mission at the Swedish Embassy. Welcome.
Thank you very much. Thank you.
All right, and right next to him is Dr. Mary Otieno, who is the UNFPA Country Representative. Welcome.
Thank you so much.
All right, and you know, to get things started, what is the significance of commemorating this day? I'll start with you, Dr. Otieno. Zambia continues year in to commemorate the midwife.
The most important thing about midwives is that they are at the heart of sexual and reproductive health. They provide services that range from antenatal care, delivery care, postnatal care for the mother and newborn, and so they are a critical component of the workforce. They are also able, if well trained and skilled, to avert almost 2/3 of all maternal deaths and complications. So they are a critical part of our workforce. In the most marginalized and remote areas, we don't have doctors. Rarely do we have nurses. And the midwife is critical in terms of making sure that women and mothers are safe. That is why every year we celebrate these heroes for their challenging work that they do in the most needy areas.
There are so many, you know, the deaths continue. The number of babies being born, you know, continue dying, or the mother dies. You know, maybe you could give us a clearer picture. I know you've been working in conjunction with the Ministry of Health. What is the gravity of maternal deaths in Zambia?
Currently, the figures are not so good, but we have had progress since the last demographic and health survey. We've seen a reduction, a significant reduction. The current maternal mortality rate stands at 398 per 100,000 live births. So much as there is progress, we've seen a tremendous reduction, there is still a lot to be done. And some of the reasons why we are seeing this challenge is twofold. One is, you know, the geographical divide. Zambia is a very big country. So you have rural-urban divide, which brings differences in terms of facilities and skilled workforce. For the urban areas is much better than the rural. You have the geographical distances that do not allow women to reach facilities. You also have the geographical distances where most midwives do not want to go. And deployment has not happened adequately. But also there is gender inequality. Then there is age differences and also wealth. People who are poor tend not to go to hospitals. So those are some of the challenges. The other challenge why we are seeing not so much progress in terms of averting maternal deaths in Zambia is because of the workforce itself. According to the midterm review of the National Health Strategic Plan 2011-2016, only less than 50% of the established posts for midwives have been filled since 2013. So that leaves a critical gap in terms of placing midwives where they are needed. So those are critical issues that are affecting maternal health. The other third point which I should mention, and which is critical, and that's why we work with SIDA on the campaign for midwives, is adolescence. That is still, we are continuing to see adolescent pregnancy increase in Zambia. So until we address that, we will not see a dent in maternal mortality. So those are some of the challenges why we are not where we are in terms of our target that we set for 2015.
Let me turn to you, Mr. Wyking. you have been working with the UNFPA and the Ministry of Health, but why the emphasis on Zambia's reproductive health system?
So thank you for that question. We've been partnering with Zambia in health for many years. And we believe that our experience from Sweden, when we developed and when we managed to reduce the very high maternal mortality rates that we had in Sweden, midwives played a key role. So from our experience, having midwives available to women giving birth, but also before giving birth and after, makes a huge difference. In Zambia, for example, Mary mentioned that maternal mortality figures are 400 per 100,000 live birth. But then imagine every woman in Zambia having about five children. So that means that if you start looking at it, probably most Zambians would know someone who has actually died giving birth. So if you have a relative or someone you went to school with or someone you know or someone in the family would have died giving birth, and that is, I think, not acceptable. It's preventable because if there are skilled midwives around assisting giving birth, but also, as we said before and after care, that reduces mortality figures a lot. And it's such an important, it's a gender equality issue. It's no men die out of maternal mortality. Yeah?
Okay, what kind of support are we looking at as Sweden giving to Zambia?
So in this specific case, we are partnering with the government, with the Midwives Association of Zambia, and with UNFPA, just to highlight the importance of midwives, just to also, to a certain extent, give midwives a sense that they matter, that they are so important. They are the unsung heroes, if you wish. But in addition to that, we have a fairly substantial support to the Ministry of Health, with a focus on maternal and child health. It's focusing on the eastern part of Zambia, but also on the southern province. So those are the main focus areas, but we also indirectly in different ways work in other areas.
Okay, and I'm aware that Sweden has a very special attachment, as well as Zambia, through UNFPA. This year's commemoration is being held in Solwezi, and so you have a very special project happening there. You want to bring us up to speed on that?
So first, just to bring you in terms of what UNFPA does with the midwifery workforce. So there are 3 areas for UNFPA. So we provide, there is education for midwives, and then there is regulation, and then there is association. And the association part is the Midwives Association of Zambia, where we've worked with Sweden.
Okay.
In terms of education, UNFPA ensures that nurses, in Zambia that is, not globally, I'm now just focusing on Zambia, that nurses who have undergone training and are fully qualified nurses are trained to become midwives, because they have different skills. So that's what we do. In every year, we provide sponsorship for about 60 nurses to go into midwifery, so that we increase the number of midwives. Now, in education again, we have worked with the Nursing Council and the Midwives Association of Zambia and the Ministry of Health to introduce a Bachelor of Science curriculum for midwives. This has been lacking, so that we have increased and a critical number of people, or young women and men, going into midwifery to college and to improve their skills. We have also reviewed the nursing curriculum and midwives curriculum to ensure that they conform with the international standards, so that we do in Zambia. In terms of association, you know that all workers need an association. It's very important for their support, for their learning, for their promotion and opportunities, and for advocacy. And so we supported the Nursing Council and the Midwives Association to come up, the midwives, to come up with their own association in Zambia. And with Swedish, we are now working with the Midwives Association of Zambia in this Midwives for All campaign in Solwezi. And so the project was launched there, and really the project is focusing mainly on adolescent girls, because adolescent girls are the ones who are at high risk of abortion, of maternal complications and death. So in Solwezi, that's what we are doing in the province, to make sure that midwives are reaching out to adolescents and providing the needed services. But we are also supporting them in terms of training, but also providing equipment for facilities, so that when women come into facilities, the facilities are well equipped with equipment and medicines to avert maternal deaths. But David can add on also what we are doing in Solwezi.
Okay. David, you want to add on the adolescent program?
Well, only then by saying that May 5th, the International Day of the Midwife, will be celebrated, I think, all across the country. But especially in Solwezi this year, we wanted to highlight that, and the Midwives Association of Zambia asked if we could help out on that to make it a little bit more than just another seminar. So it's a little bit of a happening. That's what I expect, at least. A little bit of attention to the important role that midwives play, and so that is what we're going to discuss in Solwezi, and what we're going to celebrate. So that. And
in terms of assistance, the Solwezi project for the adolescents, how is Sweden helping Zambia?
Well, on this one, we are supporting the Midwives Association through UNFPA, so that midwives can come out, can reach especially young women. But also to make themselves known, so that people also know the importance of midwives in the Solwezi area.
Okay. Now, Dr. Otieno, you had mentioned training for the midwives. How many are we looking at? How many have you targeted to train? How many midwives?
We target about 60 midwives per year for sponsorship. There are other partners, CHAI, the government, and others who are also sponsoring midwives training. But for UNFPA, our target is usually 60. If we get more, we train them. Usually, it's hard to even get people to apply for sponsorship. You'll not believe it.
Why is that?
I do not know. I've gone to the provinces and asked the PMOs why they are not coming forth for sponsorship. Maybe it's due to awareness. Maybe people are not aware that there is this available out there. And that's why it's important for such a program as ZNBC to let people know that there are agencies that are sponsoring nurses to go into midwifery. And one of them is UNFPA.
Okay. All right. Now, when it comes to this year's theme, women and newborns are at the heart of midwifery. What are your thoughts on that? Both of you.
So my thought is that midwives are our heroes. They are the backbone of sexual and reproductive health, and really we must acclaim and reward the midwives who are doing hard work in challenging and remote areas. That all partners and governments and people really need to do that. UNFPA also urges all the government and all partners to really invest in midwives, because without them we will continue to see maternal deaths. We want partners and the government to invest in quality education for midwives, in decent salaries, in improved working conditions and the improved policies, but also for give them opportunities for professional growth. Hence the Midwives Association that Sweden is also sponsoring. So these are critical. And as UNFPA, this year on the International Day of the Midwife, we are renewing our commitment to investing in improving the midwives workforce, midwifery workforce. Yeah.
David?
Well, just briefly to add that if midwives are given the opportunity to meet with young pregnant mothers or even young women who are just considering having a child, so they can talk to them before about risks and also opportunities with becoming a mother, and then see that mother through from the beginning towards delivery, but then also afterwards. And if only there were, if everyone had the chance to see a midwife during the pregnancies and while delivering, it would make such a huge difference. So I think that's a little bit the secret behind reducing high mortality figures is having midwives who are given the mandate to act not only during delivery, but also before and afterwards.
Okay. Now, earlier on, I know, Doc, you had mentioned one of the challenges, the major challenges in these maternal deaths as in relation to the distance, that in rural areas especially, mothers have to walk so many kilometers before they can have access to medical attention. So apart from that, what other major challenges do you feel affect the health sector?
The challenge of distances has been addressed in terms of building waiting maternity shelters, which we are doing, and with the support of other partners, Canada, for instance, and other donors, to make sure that when mothers, before they give birth, just before they give birth, they go and wait in this shelter, which is next to the health facility, and then they can safely deliver. So that is also being addressed. But I think we are also calling on other partners, the Ministry of Transport and other sectors, to really make sure that, you know, roads are there, that transport is there, and so there is not one single solution. Other sectors need to come in. But the other challenges is gender inequality and just lack of decision making and money to allow you to go to a health facility. For young people, it's lack of information. And that is why Sweden and the UN partners are working on ensuring that young people have comprehensive sexuality education in school, so that they have the information and skills to protect themselves from unsafe, sexual practices, but also to know to go for a service when they need it. So those are some of the things we are addressing. In terms of poverty, I think that's a developmental issue that not one single agency can address and has to be addressed. Rural-urban divide, and in terms of midwife workforce, there is the deployment issue. You will find that most midwives are in urban areas, concentrated in urban areas, and not deployed to the remote areas for obvious reasons. Sometimes nobody wants to go there because it is too remote, there's no house, there's nothing, and so they don't. But we are advocating for government to ensure and find incentives for midwives to go to these remote areas. So those are some of the challenges. We've addressed the challenge of the shortage of midwives also through deployment of retired midwives. In UNFPA, we are rehiring midwives who retired at age 55, who are still able-bodied and have skills to go back and serve in these remote areas. And we've done that successfully and seen good results.
Okay. And which areas maybe?
So we work in Western Province, in UNFPA, in Northwestern and in Luapula. So we've seen good results because of that.
Would you say those are the most critically hit areas as far as the shortage of midwives is concerned?
Not really, but in terms of maternal health indicators, those three provinces are some of the worst hit. So we chose to work there. But we need, you know, Zambia is huge. We need midwives in all areas. Because like my colleague David said, without a midwife, when you are giving birth, if a complication arises, there is no knowing what will happen. So we need them everywhere when a woman is giving birth. Okay.
And David, Sweden's help, you know, the challenges. What do you feel are Zambia's major challenges, apart from what Dr. Otieno has just said?
I think Zambia has made some very good progress with regard to health indicators. I want to say that to begin with. So a lot of things are happening, but a lot of challenges remain, of course. And one is to somehow get the good policies and the good thinking all the way from headquarters, from Lusaka to the provinces, but then out to the districts and even out to the health posts far out in the distant remote areas, as Mary talked about. And that's a challenge all over. It's not a Zambian problem, but it's something a Zambian problem alone, but it is a problem here as well. Getting funds, getting the thinking, the know-how and the knowledge all the way out. And also, you know, in cities like Lusaka, people are quite modern and they know quite a bit of contraceptives and where to go if you need help and what have you. Whereas in some of the areas, in the remote areas, there are no newspapers and even TV is not something for everyone. Radio, though, is an excellent channel, I think. So there are still ways of reaching everyone, but it takes a little bit more. It's a little bit more of a challenge to get out with information, and then, but also, as Mary says, to make sure that that there are skilled staff who are prepared to work on in the remote areas.
Okay. Now, Doctor, I want to understand, and I'm sure a lot of other people want to ask this question. Why do we have, you know, what are the immediate complications that can occur when a woman is giving birth, for example, that could lead to her death or the child's death?
So bleeding profusely is one of them. So you can bleed to death because the uterus has ruptured, for instance. When a child is breech, you know, like if the child is not facing the right direction to come out and there is breech, a woman needs what is called a C-section. They need an operation. And if that is not available, then the child dies can literally die in the womb, which causes what is known as fistula. I believe you've heard of fistula.
Yes.
So, and the woman might also die in the process. There is hypertension during pregnancy, which can kill a woman and has to be addressed. So there are a number of complications, but the immediate one is breech and a C-section, dying, bleeding to death. But after birth, that is why women are required to go back or to be monitored for 48 hours after birth. Infections do occur.
Okay.
So serious infections that a midwife can literally give an antibiotic. So those are critical. And women should go to hospital. But even if you go to a hospital and there is no skilled midwife or a doctor and there is no medication, you will still die. So a combination of factors. But a midwife is critical because a midwife can refer for a C-section to a hospital.
Okay.
Yeah. So those are some of the reasons.
Any last words before we wind up the program? I know midwives are very important people in society, so.
Just the last word is that at UNFPA, you know, our motto is to deliver a world where every pregnancy is wanted and every childbirth is safe and every young person's potential is fulfilled. And midwives are at the core of this mission. We cannot do without them. They are our heroes and they are the backbone of sexual and reproductive health, and so we need to support them and the women and newborns who are at the heart of their care.
All right. So thank you so much for having accorded us this time.
Thank you.
Thank you.
Thank you.
All right. So there you heard it. You know, we cannot overemphasize the importance of a midwife. So, you know, I hope you found this program very beneficial. And of course, the midwife is actually important because we need them so that we lessen up on the number of maternal deaths that the country is currently experiencing. Thank you for watching and goodbye.